We fortunately have a robust pipeline of therapies both in PV and ET. In ET, we have both ongoing studies with Ropeginterferon alpha 2B. Dr. Rusfertide and I are leading a global trial looking at that agent as second-line therapy for patients with ET. Certainly, if you have patients like that, please consider them for enrollment in that study. We think it'll be very beneficial, just as it has been in PV, and the support of that therapy in PV. Likewise, the LSD1 inhibitor from Imago, Bomedemstat, very active in ET. We have it in an investigator-initiated trial at my center. There's a European study. It controls platelets in patients with otherwise difficult to control platelets. In PV, we have the recent approval of Ropeginterferon alpha 2B, so that's an important new option for folks. And two, we have a whole portfolio of hepcidin mimetics, Rusfertide, the most developed of those, that's engaging in phase 3, new ones from Ionis, but the concept of creating a state of anemia of chronic disease to try to control erythrocytosis without the need for iron deficiency may have benefits both in terms of reducing risk of thrombosis and bleeding, but also improving symptoms without iron deficiency. So a robust pipeline for both groups of diseases. We're excited to see it.